It's really hard for everyone. Everyone has had to deal with feeling isolated and having their lifestyle changed in some really important ways. So for folks who are in recovery, especially in new recovery, those things are even harder to tackle, and it puts them at increased risk for overdose.
It's just over 1 year since COVID-19 changed everything about how we operate as a society. The pandemic has led to a surge in substance abuse and forced many changes, leading to an increase in new users, relapses, and overdoses. People on the front lines fighting the opioid epidemic say that death rates are on an alarming rise.
We've seen these deaths of despair. We've seen this increased rate of overdose fatalities. This is the highest number. 2020, we have never, ever seen numbers like this in Arizona.
Prior to the pandemic, we were kind of hopeful that the opiate overdose rate would start to come down. We had some promising data. We're like, okay, we might see like a 1, maybe a 4% decrease. And then the data was just released for 2019 through the June of 2020, and it actually increased another 10,000 deaths.
One of the things that we're seeing an increase in, and an increase in mortalities related to, is the use of methamphetamine. We're seeing it used in combination with opioids, and we're seeing mortalities from the combination, but we're just also seeing mortalities where it's the identified drug from the mortality.
The Pima County Health Department has reported that heroin and fentanyl seizures are up more than 20 and 40% from last year. Since July of 2020, more than 95,000 fentanyl pills have been seized, which is more than double of what was confiscated for all of 2019.
One of the rising concerns about the drug population in Tucson is a lot of things are cross-contaminated with the deadly fentanyl that we're seeing coming in from Mexico. So even if you're not necessarily somebody that prefers opiates, you might get something that's tainted with it. Even if something considered benign like cannabis from the street could be cross-contaminated with fentanyl.
Sonoran Prevention Works is a grassroots organization based throughout Arizona that helps reduce harm for people using substances who are not ready for recovery. Harm reduction is a philosophy and set of strategies that reduces infectious diseases like HIV and hepatitis C by providing clean needles and reducing overdose rates by supplying fentanyl strips and Narcan kits. Narcan, also known as naloxone, is a medication used to reverse the effects of an opioid overdose and is instrumental in saving lives.
We are seeing a lot of returns to chaotic use, which is also leading to a rise in overdose fatalities. We also have more people using by themselves because of the isolation, because of being cut off from society, and the drug supply is poisoned. It's just a recipe for disaster. And in a lot of rural communities, certainly tribal communities, it takes a while for EMS to get there. And once you stop breathing from an opioid overdose, you have 4 minutes until you die. So, people who use substances and anybody who is around them really needs to have access to naloxone or Narcan, which will work on opioids, including fentanyl.
The most effective treatments for opioid use disorder are medications such as methadone and buprenorphine, which are heavily regulated. But due to COVID-19, the federal government allowed a temporary easement on restrictions to allow for take-home doses to reduce in-person contact. That, coupled with the expansion of telehealth services, has had many positive outcomes.
The past year, we have learned a lot of new and different ways to do our work. We used to do our flagship training, which is called Overdose Prevention, Recognition, and Response. That used to always be an in-person situation. And now those trainings are offered multiple times per month, and they are done over Zoom online. We also started a program where we allow folks to request naloxone through our website, and we fulfill the majority of those requests by mail. This is really, really helpful in increasing our reach in rural areas. Those folks who take medication-assisted treatment, especially methadone, they're able to get a lot of their life back when we don't demand that they go to the clinic every single day to pick up their dose.
Rural communities like Mojave County in Arizona has seen significant numbers of overdose fatalities and higher cases of HIV and hepatitis C because of needle sharing and less access to services. But now Sonoran Prevention Works is seeing positive changes resulting from adaptations made during the pandemic.
One thing that's really cool that happened here is our local methadone clinic expanded their hours and saw a big increase and return of former clients. Kingman's kind of a late town, so staying open until the afternoon, and they didn't have to stress so much about making it to the clinic before it closed. I also see just a lot of really positive changes. I see people carrying naloxone. I see people teaching their friends how to use naloxone, talking with their friends about how to stay safe from fentanyl. I see people getting jobs, getting their physical and mental health taken care of.
Kodak Health Recovery and Wellness is one of Arizona's oldest providers of care for mental health, illness, addiction, and trauma, and have remained open 24/7 throughout the pandemic.
If you want to look at the biggest positives out of the last year, really was the implementation and the increased use of telemedicine and telephone services. It's really enabled us to keep better contact with our members by allowing us to really expand the methods that we can use to keep in touch with folks. We've increased the number of people we're able to contact and the frequency that we're able to keep in touch with our members. Altogether, we treat about 2,300 people at this clinic for different types of services. Now, what we did find over time is a lot of those people started asking to come back. They really benefit from the structure of being seen every day, really to help them make those changes in their lives and to stay clean.
With overdose fatalities being on a troubling upward trend in Arizona, educating the general public is more important than ever. Destigmatizing substance abuse and knowing what Narcan is, where to acquire it, and how to administer it means saving lives. Organizations like Sonoran Prevention Works and Kodak provide these materials and training.
You don't just take a Narcan kit and take it home and figure you know how to use it. Even as we give it out, we train people how to do it. Our staff have been trained by either ASU or Sonoran Prevention Works as well. They understand how Narcan works. You know how to administer, where to administer, when to administer, and we do that same training with anybody that we give that kit to.
We have easy access to Narcan kits. Our big VA or national VA provides those to us, but the university doesn't have an easy access to Narcan kits. So if somebody comes to the emergency room, for the longest time they weren't able to just provide a Narcan kit if you had an opiate overdose. You had to go to the pharmacy to get a kit, and that just those extra steps. So I think manpower and kind of just the actual kind of materials, both resources are needed. And I think once this is all over, the number of rehab beds that we will eventually need are far greater than what we have in our community or even, systemically.
We have to do a lot of work to convince the public, providers, family members that people who use drugs do want to take care of their health, dispel a lot of the myths around substance use disorder as well as treatment and recovery. And I think that what the whole pandemic has shown is that when an issue is prioritized, we can act fast. Where there is public and political will, we can find solutions.